body. Getting ready for your hospital stay. Well, this is one point in getting ready. You had all your appointments. You come to the class. You have a care partner identified. You have your medications. And then I or one of the other nurses will call you and tell you what time to arrive the day of your surgery. And the reason I've dragged you all the way over here is because this is where you're going to report. You're going to report to the same 7th floor sky lobby. And I think that's one less fear that you'll have. Then you'll know exactly where to come the day of surgery. And we'll let you know what time. The earliest you need to be here is 6 a.m. The latest is probably around 11 or 12, depending on where you fall into the schedule. And something else we want you to think about are your discharge options. Are you going to go home or are you going to a rehab? If you go home, we will send a nurse and a physical therapist to your home 3 times a week for 3 weeks. If you're going to go to a rehab, we want you to start thinking about where do you want to go. We always prefer you to go home. But that being said, we don't want you to go home to an unsafe place. So if you have no one there that can be helping you, then we will have someone talk to you about options of admitting somewhere. And that's usually Portia, our social worker. And Portia will discuss different places that you can go. And Portia's number is in the last sheet on your syllabus. So make sure you connect with Portia. If you're going to go home, we're going to set up a rehab, a home health care service come to your home. And we do have someone who's a specialist in that, and her name is Allison. And Allison will come and talk to you, too, about if you prefer someone. Allison works for ATI, and she will be present after the demonstration if you'd like to talk to her. And as I said, the work situation, you're getting ready. Your employer knows you're going to be off for 12 weeks. I want you to know that you are being admitted to a private room on 9 East, which means you have a bed in there for you and you have a bed for your care partner. So if your care partner wants to stay the night and just kind of hold your hand, that's perfectly permissible with us. It's not required, but if you decide that you'd like to have someone stay with you, that's fine. The patient orders meals anytime they want. There also is an option for your care partner to order meals. And if you're having a hip replacement, you're usually here about 1 night, and you can go home later in the afternoon of the next day or evening, early evening. If you're here for a knee replacement, you're usually here about 2 nights. And we ask your care partner to pick you up by 11 o'clock on that 3rd day. Some of the things that have happened while you're here is you're going to have a drain at your surgical site that will be draining fluids and taking away all that fluid that's accumulated. That drain will be put in during surgery and come out the next day. You're also going to have a Foley catheter that's put into your bladder to drain the urine, and that also comes out the next day and put in during surgery. You're going to begin some physical therapy. They'll come to your room 1 to 2 times a day. They'll make sure that you understand everything that's required. Pain management. We want to make sure that your pain is under control. And then education about the blood thinner that you're on. Now, the physical therapy, the pain management, and the blood thinner education, those are very important things. Those are criteria that we kind of watch for before we actually discharge you. There's equipment that you will receive. One of them is the wedge. You can see here it's a foam wedge that your leg rests on, and that's great for elevation for a knee replacement. If you're having a hip replacement, you do not receive the wedge. But you will have a wedge that fits between your legs to make sure your hips don't cross over after surgery. But that wedge is very important. I've delivered that wedge to people in the city because they forgot to take it. So take it home with you. I really believe in that for your elevation. The incentive spirometer, which is another big word for saying your breathing machine. It's just a little machine that's plastic that you breathe in and out, and it keeps your lungs open and keeps you coughing and prevents blood clots or pneumonia. Take it home with you. Your walker. We've asked you to come in the hospital with a walker, but we also want to make sure when you leave that you have the walker. Now, I say to the patients, if there's things that you're using while you're here, you're using it because it's best for your recovery. We want you to use it. So take it home. You paid for it. And use it at home because it's going to help with your recovery. But we do ask you to leave our TVs and our VCRs because we do want those. After surgery, home discharge. So once again, someone will come in and talk to you about home discharge. Allison will come in and talk to you about the agency who's coming in. We want to make sure that there's going to be someone home with you. And that nurse and physical therapist will come to your home 3 times a week for 3 weeks. The nurse that comes to your home is taking blood to make sure your Coumadin is on the right level. The therapist will be working with you, make sure you're progressing every day. If you have a home health agency that you're working with now and you really like them, let us know because we can identify who they are and we can make sure that they continue with you. Look around your house. All those little rugs that look so nice, take them away. They have problems that you could possibly trip on them. They're obstacles for your rehab. So take away the home things that might be a hindrance to your recovery. So aftercare for rehab discharge. Like I said, you'll talk to Portia, and Portia's number is there, and then she can help identify with some of the home health agencies, the nursing home rehabs that we use. There are some that we prefer, and we will work with you with them. We ask you to visit those facilities. Look at how big it is. Is it clean? Are you comfortable there? Do you feel safe there? Do the patients like the food that they're eating? Those are important things. And maybe have 1 or 2 choices for us. Time in rehab is 5 days to 14 days. I had one gentleman who went there in the morning. He came home in the afternoon because there are milestones that you have to reach. And once you reach those milestones, the rehab has to send you home. Otherwise, it's fraud. So we say anywhere between 5 and 14 is about the normal rehab length of stay. Some of the things that I want to talk to you now about what you can expect after surgery. Number 1, I want you to know that this is an enabling procedure, not disabling, which means we are going to make you better after surgery than what you are today. So that being said, this does not require that we hand out something for you for permanent disability. You'll have the 12 weeks off, and you'll also have a parking permit, a disability parking permit for 6 months after surgery, and we will give that to you. Now, some people at this point do have permanent parking. You can continue with that, but Dr. Lou won't increase that, but whoever you got the original one from, they can increase it for you. Driving, this usually is asked by all the gentlemen, when can I drive? So it's usually about 4 to 6 weeks. But more importantly than that, it's when you're off all narcotics for 48 hours. Because I know that there are a lot of people out there driving on Vicodin, which is a narcotic, and we'd never advocate that. But if you would get in an accident and they found out that you had a narcotic on board, you could be in big trouble. So no narcotics for 48 hours. And that's approximately 4 to 6 weeks. Now you will be on, the last medication you'll be on is Ultram or Tramadol. That is not a narcotic. It's a very good pain reliever. You can drive on that. You can't get your incision wet for 3 weeks. Now if you're having a knee replacement, that's kind of simple. You can wrap it with saran wrap and still take a shower. Hip replacements is a little difficult to wrap the area. I don't care how you do it. If you use duct tape, saran wrap, anything that you can use, but you cannot get it wet for 3 weeks. Going back to work, 12 weeks. 12 weeks of physical therapy. The first 3 weeks will be at your home or at the rehab unit. And once you're released from doctor at that 3-week period, you can choose your own rehab where you want to go, the freestanding rehab. Now, we do have affiliation with ATI, and ATI has a program that they will come and pick you up and bring you home because you remember, you may not be driving at this point yet. So once you find out where you want to go for your rehab, your physical therapy, see if they have a drive program for you. Your appointments that you'll see doctor after surgery, the first one will be at 3 weeks. You'll see the nurse practitioner. The knee patients, they'll take out those staples because you will have staples. The hip patients, they'll just look at the incision. At 6 weeks, you'll see your doctor, and he'll take an x-ray to make sure everything looks okay. You'll see the doctor again at 3 months, and at that time, he probably will cut you loose and saying, you're doing great, come back at a year. But now if he feels like there's a little bit of concern, he wants to keep his eyes on you, he may have you come back again at 6 months, and we'll see you as long as we're feeling that we could help you along the way a little bit more. And then we like to see you every year for that replacement. Other things as you can expect, reduced pain. We're going to make you better than you are today. You're going to have surgical pain, but we have all kinds of medications for that. But you won't have that bone-on-bone pain. Now I see a lot of people shaking their head. That bone-on-bone pain is what really hurts. And we're going to get rid of that with your joint replacement. You can expect no drainage or no bleeding. Once you leave here, there should be no drainage or bleeding come from your incision. If there is, I need to be called right away. Jennifer needs to be called right away. There should be no bleeding or drainage. That area that had surgery is going to feel warm, and it's going to feel warm for about a year. That warmth does not indicate infection. It indicates healing, because your body is sending blood there. It's kind of bathing the area and making all kinds of good things happen to heal it. Swelling. You're going to have swelling. You had surgery below your belly, but you know you're going to elevate your leg higher than the level of your heart. Pain as you break scar tissue. Now this is for my knee replacement people. I think knee replacement people are heroes. It takes a lot of therapy to get great optimal benefits with a knee replacement, but the benefits are so worth it. What happens is your body, normally when it has an injury or sore, it produces scar tissue. So your body is making scar tissue in that knee area. So what you need to do is break the scar tissue. So you're going to be bending and straightening. I can't even tell you how many times a day. There's not too much. Bend it and straighten it, because when you bend it, you're breaking that scar tissue. Now, a lot of my folks say they had a wonderful therapy session. They go to bed, have a great night's sleep. They wake up in the morning, and that knee is all stiff again. What happened during the night? Scar tissue developed, yes. So you almost have to go back to the beginning, but every day it's less and less. And after about